Hello everyone, this is Dr. Monesmith. I made these short exercise videos to help you strengthen your lower extremities before and especially after surgery. Many patients struggle after surgery, even with formal physical therapy, to do their exercises correctly, and oftentimes they are given far too many to do at home. So I'm going to show you a few simple ones to work on with the aid of my physician's assistant, Kim. The prone hip extension also works your gluteus maximus muscle, which is your hip extensor, and Kim demonstrates here. You lay flat and then keeping your leg straight, you lift up, and you want to keep your pelvis flat and level, and at the top squeeze, and you should feel this basically in your buttock. The hip abduction exercise works your gluteus medius. This is the more advanced. Once you're getting some strength, you can lay down on your side, and as Kim demonstrates here, simply abduct your hip or lift your leg up and hold, and then slowly bring it back down. The standing hip abduction is a simple exercise you can do standing at the sink or the counter or using your walker. Simply stand straight, keep your back and pelvis level, and bring your hip and leg out to the side and hold at the top and then slowly back down. Similarly to the abduction, this is the hip extension. And this time you're simply taking your leg backwards and squeezing your rear end at the top of the exercise, bringing your leg back down slowly. This is the standing hip flexion, and it basically is just similar to the other two, but you're standing, taking your leg forward, holding at the top, and lowering back down. This demonstration of proper squat technique shows that you want to keep your back flat, your weight on your heels, knees behind your toes, and head up. As you drop into the squat position, your weight should be on your heels, to the point that if your hands were not in front of you, you would probably start to fall backwards. See how my toes are pointed out about 10 degrees, and the knees point towards the toes, and again, weight on the heels. Today is the wall sit. And we will show it from a couple different angles, but you want to be leaning back into the wall, your back flat against the wall, your toes out about 10 degrees, feet slightly wider than shoulder width. And again, as you slide down, weight is on the heels. You don't need to go past 90 degrees. You stop, hold, and then back up. The hip bridge is an exercise to strengthen your hamstrings and your gluteal muscles. Kim is using a floor mat, but you can use a carpeted surface or a floor mat, or even your bed if it's firm enough. But the basic idea is to lay down flat on your back with your hands at your sides, your knees bent about 90 degrees, your toes up off the ground a little bit like Kim is demonstrating, then pushing through your heels, you bring your pelvis up towards the ceiling, squeezing your gluteus, which is your butt muscles, at the top. If two legs is easy, you can do it with one leg, which is a more advanced exercise, which Kim is demonstrating here.